Is sponsored by KidMed Pediatric Urgent Care.
We're joined today by the co-founders of KidMed Pediatric Urgent Care, Dr. Jeff Bennett and Dr. Mark Flanzenbaum. It's wonderful to see both of you back with us today. Thanks so much for making time.
Thank you.
Thank you, Jess.
Absolutely. We've talked in the past. KidMed is a pediatric urgent care practice dedicated to the convenient and urgent care of ill and injured infants, children, and young adults, ages newborn through 25. That covers a lot of ground, but you are there for families in the Central Virginia area, and you've been very passionate about launching this business.
Yes, we have. And I think that we are, what makes us unique is that the pediatric community is extremely passionate about the fact that we have so much pediatric experience, and that's why we did residencies and specific training in pediatrics. And I think that's how we differ between the other. Your kids should either go to their pediatrician, to a pediatric specific urgent care, or a pediatric specific emergency room. And where we have things to offer is that the pediatricians don't have an x-ray, so they're limited in their ability to do orthopedic examinations due to that. And we're able to do some procedural type things that's very difficult to do in an office setting, like incision and drainage of abscesses and laceration repairs and things along those lines. The emergency rooms are quite capable of doing those, but we do them at a fraction of the cost. So the other thing is the difference between us and the adult-based urgent cares is that we see kids all day, every day, and we feel very comfortable seeing children. And I think that really shows when people come to us.
Parents should think of you, parents and families think of you as a resource in this community, several convenient locations and easy to access. You're there for families when they need you for a variety of things. And of course, ages newborn through 25 covers a lot of ground. You've responded so quickly to so many things in this time that we're living in right now. And that continues to evolve now. You've been welcoming families in, and the way that they can come and see you is pretty convenient.
We're trying to limit the amount of exposure that families and the kids have, and are both on their end and on our staff end, just to keep COVID from spreading more. So we've always had the ability to have people walk in. We've now introduced, since COVID started, the ability for a telemedicine visit, and we're introducing in the next couple of weeks the ability for an online reservation save your spot model. So patients will have three options. They can either come here, register online from their car, they can register from home and stay in their home where they're safe with their kids and comfortable at home with their kids, or they can do a telemedicine visit. All three are very viable options.
Telemedicine specifically is a great avenue for people to come in when they have COVID concerns. Friends call all the time and say, when should I come in for COVID testing? And the answer is, for the people that don't have any symptoms, is to come in minimum of 4, preferably 5 days post-exposure. The kids, especially the older kids, they just drive up, they get swabbed. We have 2 rapid tests, and depending on your symptoms, we're able to do the molecular or antigen testing. And then you drive off and we call the same day with results.
Doctors, KidMed Pediatric Urgent Care has been in business now in Central Virginia for more than 11 years. You've seen so much happening. And of course, you've responded to COVID-19 and the world that we're in. We have flu season ahead. So when should families be getting in touch, and how are you responding to flu on the horizon?
If your child is symptomatic, has any flu-like symptoms, fever, chills, body aches, sore throat, anything that is an illness-related thing, we recommend they come in as soon as possible, because the COVID testing is most accurate within the first 5 days of symptoms. Flu testing, the treatment available, but only within the first 48 hours of symptoms. So the sooner the better with that. We're expanding our testing capabilities. We have more machines to do the testing. All of the tests are rapid tests, and we will have the results that same day.
And now that more and more kids are getting back to school, whereas COVID is not as transmissible at a school age, flu really is. So there's going to be a lot of kids with febrile illnesses, and we fully have the capability of testing for both, so we know right away hopefully which one is causing the problem.
And a lot of families with questions. So thank you for being there for us. KidMed Pediatric Urgent Care. It's great talking with you, doctors.
Thank you so much.
Thanks so much.
Thank you.
Absolutely appreciate it. We'll be sure to share all the information so that families can connect with KidMed Pediatric Urgent Care right here in Central Virginia.
KidMed Pediatric Urgent Care has 3 locations: West End, 4687 Pouncey Track Road. Give them a call at 804-422-KIDS. Find them in Midlothian, 5021 Craig Rath Boulevard. The number there is 804-592-KIDS. And they have a location in Mechanicsville. Of course, it's on Bell Creek Road, 8356 Bell Creek. And the number there is 804-559-KIDS. You can find them online at kidmedva.com and on Facebook at KidMed. Jess, what a great resource for families in the Richmond area. You know, a generation ago, we didn't have something like this. And like you said, they've been around for 11 years now and really have established themselves. And it's kind of like that luxury that starts out as something, oh, that's kind of cool, and turns into a necessity that we all really need.
And that's a great point, Bill. They started 11 years ago. These 2 doctors, co-founders, Dr. Bennett, Dr. Flanzenbaum, are both very passionate, and it was almost as though they saw efficiencies in being able to get the care to kids and families more quickly, and just go with that targeted approach. And so it's neat to see the business. I was there with them, talking with them when they first launched, which feels like 2 minutes ago, but already 11 years ago. So to have seen them grown, that's pretty incredible. And when I was talking with them, Bill, I'm just amazed. We featured so many businesses that have evolved during this time, and they are a great example. Dr. Flanzenbaum was talking about the development of this app where it'll be the kind of save your spot in line. But I'm so incredibly impressed by businesses that have adapted so quickly to meet, customers and families right where they're needed.
It's interesting to see how different, different businesses and different professions are able to kind of ramp up very quickly. And obviously, these guys are top-notch doctors, and they use technology a lot. So I guess when you think about it, not surprising, they were able to adapt really quick, done a great job. And I'm sure it makes a lot of difference to a lot of parents, and of course to the kids, but to the parents, to have a little peace of mind to know that they can actually get through to this doctor when they need to.
Yeah, 2 talented gentlemen, and of course, an incredibly talented team that they're surrounded by to make that happen. But, it's inspiring because there's so many things pulling at our attention before and certainly now, and to be able to innovate in that way, I'm just mega impressed. So great job, KidMed Pediatric Urgent Care, doing great work.